co-chair for many, many years of the Diabetes Caucus in the Senate, Senator Shaheen.
Thank you, Chair Collins, and I appreciate your letting me sneak in since I am in the middle of a defense bill markup, but I really wanted to be here to thank all of you who are members of the Children's Congress for being here today, for your advocacy every day, and for your willingness to speak up about the need, as Senator Hyde-Smith said, to find a cure. And none of us forget that at any time. I have very much appreciated all of the work that the Diabetes Caucus has done over the years and the leadership from Senator Collins to provide additional funding and to improve treatments. And clearly we have more work to do. Thank you to Dr. Rodgers and to all of the panelists for being here and for your testimony this morning. I'd like to begin with Rachel, since she's from New Hampshire, and ask what advice you would give to someone who's just been diagnosed with type 1.
Yeah, I still remember the day I was diagnosed. I was 11 and I got taken out of school, and luckily I wasn't hospitalized, which was honestly kind of surprising because my blood sugar was very high. And I would just tell people who are diagnosed that I know it's very scary when you're first getting all this information about there's so many different factors, pricking your finger and giving yourself insulin and counting carbs. It can be very scary, but it definitely gets better the longer you go. And I remember the first week I can barely remember because it was just, I ate so much food and yeah. But I've been a diabetic for 4 years now, so I would say I'm definitely more educated, and I'm here today, so it's proof you can really do anything, even with this disease.
Would either of the other witnesses like to comment on that question? Ruby?
No, I think Rachel covered it. I think that's
Great.
That's pretty much what I was going to say, yeah.
Katie, anything to add?
She did a great job explaining it, but it is terrifying at first, and it is incredibly scary. And even for me, 8.5 years later, it is still hard, but I had to figure out how to make it work because I wanted so much with my life, and I still do. And I wouldn't necessarily change what happens to me because it has given me so many incredible opportunities, one of them being here. And a newly diagnosed person also has so many incredible opportunities and a bright future if they want that. So yeah, it's just not giving up and figuring out how to do it because it's hard, but you're still here and you can make an incredible life out of it.
Thank you. Thank you to each of you. Excuse me. Dr. Rodgers, I'm concerned that this administration has terminated or frozen more than 260 NIDDK grants in 29 states that total more than $120 million. In addition to these cuts, the proposed NIH budget would slash NIH funding and potentially gut NIDDK by combining it with other institutes. So can you speak to how important it is that we continue to fund diabetes research, including ongoing trials and prevention initiatives, and why that should be prioritized and protected from reductions?
Well, Senator, we really, some of the major accomplishments that we've discussed today is one very good example of why your continued support for ongoing research in diabetes, in particular in type 1 diabetes, is so important. We're really on the cusp of some major breakthroughs, especially related to cellular therapies and finding a biological cure. We have studies that I've told this committee about before. TEDdy study, the environmental determinants of diabetes of the youth. What is it that triggers the autoimmune disease? We required studying some 425,000 at-risk kids to enroll 6,000 from the age of birth to 15 years. And I'm happy to report that the very last patient turns 15 this year. And so we're already on the cusp of understanding what some of these triggers are. And that's the kind of work that we have to roll up our sleeves and really continue, because that's where the cures will manifest themselves. And so I couldn't give you a better explanation of why this support has been so important, and ongoing support will be especially important.
Well, that's an excellent explanation. Thank you very much for the great work that NIDDK continues to do. And thank you to all of the delegates from the Children's Congress for being here.